Hi, I'm Carol Thayer and I'm one of the lymphedema specialists here at St Luke's Hospice, and today I'm going to talk to you about skincare. Skincare is probably the most important aspect of lymphedema care, and we teach it to all our patients. But why is skincare so important? It's probably the best way to reduce the risk of infection. The particular infection that I'm talking about is something we call cellulitis. That's a deep tissue infection caused by a bacteria which can spread very quickly. The best way to reduce your risk of infection is to have good, supple skin, well moisturised. So we ask you to moisturise your skin every day. Now I'm sure quite a lot of you are already using body butters and skin lotions that you've got for Christmas. And if that's working for you, that's great. But if your skin is particularly dry or sensitive, you may need something prescribed by your GP, and we can organise that in the clinic. When we ask you to moisturise your limb, we ask you to do it in a particular way. This is because we want to redirect fluid from the swollen area. I'm sure your specialist nurse may have shown you this after your surgery, but I'll demonstrate now on Kirsty. Just raise your foot, Kirsty. Drop down on there. Okay, comfortable? So we use plenty of cream, even more than that. And we start applying at the top of the arm. And we stroke in an upward manner. And we mustn't forget underneath. Go all the way around. And pay particular attention to those dry areas, knees and elbows. It's important to take your time and allow the cream to soak in. We can always go back over, but always starting at the root of the limb, the top of the arm or the top of the thigh, working all the way around. Right down to the back of the hand or the foot, and working down every finger. When you're finished, we ask you to do one gentle stroke down, which is quite the opposite of what I've just said. But this is to lie the hairs or the hair follicles down, because if you don't, you can get irritation called a folliculitis. I hope you found that helpful, and if you've got any questions, don't forget to ask your specialist.